Today, I'd like to talk about the latest treatments for diabetes. Would you believe it if I told you that your body actually has the power to change diabetes? Moreover, what if I told you that this power lies within the very fat you've been trying to reduce for years? How would you feel if you heard that this power is found in your fat? Today, I'll be talking about this cutting-edge treatment, stem cell therapy. Every week in the examination room, I hear stories like this from patients with diabetes. They say, I take my medication every morning, I check my blood sugar every day. I'm careful about my diet too. And yet, their kidney numbers get worse. Their feet become numb and their vision deteriorates, and the number of medications keeps increasing. Currently, it is said that there are about 500 million people with diabetes worldwide. Many of them, especially those who have had the disease for a long time, are facing the same obstacles. Both insulin and medication do lower blood sugar levels. However, when it comes to treating complications, the longer someone has diabetes, the greater the risk becomes. Oral medications and insulin are very good drugs. However, the function of the beta cells does not recover, and insulin resistance is also very difficult to improve. Moreover, these treatments do not have a direct effect on most complications. However, in the past few years, the situation has begun to change. Now, there are treatments that not only lower blood sugar levels, but also repair the disease itself. Such new treatments are emerging. So does stem cell therapy really work for diabetes? Regarding that question, I would like to discuss it now, incorporating data from research papers. So does stem cell therapy really work? Let's look at the numbers. In 2020, a meta-analysis was conducted that integrated the results of 21 clinical trials. Patients with type 2 diabetes received treatment with mesenchymal stem cells. Here are the results. Hemoglobin A1c decreased by an average of 1.5 points. If you check your hemoglobin A1c every month with blood tests, you'll immediately understand how significant this number is. And there's even more astonishing data from here. Another figure emerged from the same study. There were 64 patients with type 2 diabetes. Amazingly, 20 of them, 1 out of every 3 people, were able to completely stop insulin injections. Furthermore, 42% of the patients were able to reduce their required insulin dose to less than half. There are also astonishing numbers for type 1 diabetes. In a group of 8 patients who had recently developed type 1 diabetes, after undergoing stem cell treatment, 2 of them were able to stop insulin injections during the 3-month observation period. As you can see, this is a remarkable treatment that can reduce the amount of oral medication or insulin needed, or even make it possible to discontinue them altogether. Next, I would like to touch on data from the latest research published in 2025. Compared to those who did not undergo stem cell treatment, the probability of improving blood sugar levels was found to be 3 times higher. Furthermore, compared to treatments using other people's cells, data also showed that treatments using one's own cells were 5 times more effective. It has also been found that people with type 2 diabetes are 3 times more likely to see positive effects compared to those with type 1 diabetes. This raises a question. Is this stem cell treatment really safe? What about side effects? I believe these are the biggest concerns for patients. 15 years worth of data, 62 cases of treatments using stem cells, and observations of 3,546 people. Among these, there have been no reports that stem cell treatment directly caused serious adverse events such as death or infection. So far, we've been talking about blood sugar. From here, I'd like to talk about complications. Insulin is what keeps us alive. However, stem cell therapy tackles complications, the real enemy lurking behind them. The first complication of diabetes, nerve damage or numbness. With stem cell therapy, blood flow and nerve regeneration can occur, potentially easing numbness and pain. The kidneys are said to be an organ that, once damaged, cannot recover. They are also a cause of dialysis. For diabetes patients, the kidneys are a source of considerable anxiety. It has been reported that stem cell therapy statistically improves the kidney indicator known as eGFR. Diabetic retinopathy, this is a cause of blindness. Unfortunately, when it comes to diabetic retinopathy, there is no large-scale data available in humans. However, in animal experiments, improvements in blood flow and suppression of neovascularization have been demonstrated, so there are high expectations for future research. And finally, there are foot ulcers. For those suffering from diabetes, you may have heard of cases where people had to have their feet amputated. These foot ulcers caused by diabetes, there is data showing that the probability of complete healing with stem cell therapy is as high as 56%. Furthermore, the number of days required for treatment is said to be, on average, 19 days shorter. What I have discussed here is not speculation. these are reports based on existing data. The stem cell treatments I have talked about so far. Japan is different from the rest of the world. In 2014, Japan established the Act on the Safety of Regenerative Medicine, which includes stem cell therapy. Currently in Japan, under this law, only clinics that have notified and received approval from the Ministry of Health, Labour and Welfare are allowed to provide stem cell treatments. The cells are produced at certified facilities. There is also an obligation to report progress and adverse events to the government. Because of this background, not only Japanese people, the number of people coming from overseas to receive stem cell treatments is also increasing. Our cell ground clinic is located in the heart of Shinsaibashi, Osaka. We have as many as 13 types of regenerative medicine provision plans approved by the Ministry of Health, Labour and Welfare. Of course, plans for diabetes and pre-diabetes have also been accepted. This stem cell treatment. There are 3 main types of stem cells used: umbilical cord, bone marrow and fat. These are the 3 types. The one we have chosen is stem cell treatment using your own fat-derived stem cells. Why is that? The reason is simple. It is easy to collect. By using local anesthesia, we can extract fat through a small incision. There is no need for hospitalization. The procedure takes about 30 minutes. It can be said that this method puts the least burden on the body, and the greatest advantage of stem cell treatment using your own fat is this. The reason is that since your own cells are used, the chances of rejection or allergic reactions are very low. Safety is the top priority when receiving treatment. At our clinic, we take the utmost care to ensure this safety. Many measures have been taken to improve both effectiveness and safety. That is why it takes time. The cost is also accordingly higher. However, it will be something made just for you. At our clinic, we cultivate your cells from scratch over a period of up to 7 weeks, just for you. The stem cells we use at our clinic are living cells. Their survival rate is over 98%. They are young cells that have not been excessively cultured. The number of passages is within 3 passages. And for each treatment, up to 200 million stem cells can be administered per infusion. The treatment process is simple. It is also possible to have an online consultation in advance. During your first visit, we will conduct a consultation and collect fat tissue. There is no need for hospitalization. It will be finished in about 30 minutes. After that, you will need to wait for about 7 weeks. During this period, we will carefully culture the stem cells just for you. Then comes your second visit. This will be the day of your treatment. The stem cells will be administered slowly via an IV drip over time. We take every precaution to minimize the risk of side effects, such as allergies, and ensure the procedure is performed safely. Our cell ground clinic is about 50 minutes from Kansai International Airport. To those of you who have been suffering from diabetes for many years, the stem cell treatment I discussed today is not meant to deny conventional medicine. It is intended to be an additional option on top of your current treatment. It adds another choice, one that aims to repair the root cause. Whether it is suitable or not varies from person to person. If you are interested, please feel free to contact us by email or other means. We look forward to hearing from you. First, regenerating the pancreatic beta cells. Stem cells are like repair workers for the body. Stem cells release various growth factors such as VEGF and IGF-1. These growth factors help regenerate beta cells and protect the remaining beta cells. In the case of type 1 diabetes, they calm the overactive immune system that attacks the beta cells. Second, they improve insulin resistance. This happens inside the cells. In muscles, liver and fat, there are glucose entry points called GLUT4. They increase the number of these entry points. They also reconstruct the insulin signaling pathway. Furthermore, they turn off the inflammatory switches that interfere with insulin. They reconstruct the cellular mechanisms that have become rusty over the years. Third, they reset chronic inflammation throughout the body. This is an extremely important function. Type 2 diabetes is now considered a disease caused by chronic inflammation. Stem cells switch aggressive M1 macrophages to reparative M2 macrophages. They also increase the number of regulatory T cells. Furthermore, cytokines, they change the substances that transmit inflammation throughout the body from destructive to protective types. Stem cells have the power to stop this much inflammation. Let me speak honestly here. This stem cell treatment is not recommended for all diabetes patients. The people for whom stem cell treatment is suitable are as follows. Patients with type 2 diabetes that cannot be controlled with medication. Patients with neuropathy who experience numbness or pain in their hands or feet. Patients whose kidney function has just begun to decline but still have some reserve capacity remaining. Patients with foot ulcers that do not heal with standard treatments. And patients with type 1 diabetes who are within 1 to 2 years of diagnosis. These are the types of people for whom stem cell treatment is suitable. On the other hand, there are also patients for whom stem cell treatment cannot be performed. Active infections and patients with conditions such as HIV or hepatitis B. Additionally, patients with ongoing cancer, these individuals also cannot receive stem cell treatment. Stem cell therapy is truly an excellent treatment, but it does not produce the same results for everyone. It is not a magic cure.